Time now for Morning Rounds. Joining us are CBS News chief medical correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips.
First up, the Centers for Disease Control issued a new report on outbreaks of measles. John?
Vanita, measles has been preventable with a vaccine for decades. And in an average year, there are usually about 60 cases nationwide. But so far this year, there have already been more than 100.
Good job.
This clinic in Santa Ana, California is offering free measles vaccinations.
Hi.
There have been 21 cases of the disease in Orange County, 49 total in the state. Last year, California had only 4. Dr. Eric Handler is the public health officer for Orange County.
It's alarming because measles is a preventable disease. And part of the problem is that we have pockets of populations in Orange County that are not getting immunized.
Until today, that included Susan Ireg's children, 9-year-old Kayla and 11-year-old Ethan. Susan's fear of measles overcame the family's concern about the safety of vaccines.
Now that there's an outbreak, my children will be quarantined from school if they don't have these shots due to the measles outbreak and potential exposure.
In New York City, there have been 25 cases this year, 12 in children. Of those children, 8 were infants too young to be vaccinated. 2 children were not vaccinated because their parents refused to do so. Over the past 20 years, the vaccination rate against measles has been stable at more than 90%. The CDC says that's enough to prevent a widespread epidemic, but those who remain unvaccinated may get infected themselves and spread the disease to others.
John, I have a 2-year-old, so this has been a recent topic in my own household, and we chose to vaccinate our son, but I do know other parents that have chosen not to. Does that have any correlation? I mean, why are we seeing these outbreaks now? Is it as a result of other parents not doing it?
Well, yeah, I think what's happening now is that there are parents who are making the decision for whatever reason, either not to vaccinate their kids or to spread them out, and so that they're not properly vaccinated. And then what happens is if people travel abroad, it's pretty well controlled here in the United States. We don't see a ton of it. But around the world, there are 15,000 cases in the Philippines this year alone.
Wow.
So you have travelers who go outside who are not properly vaccinated, they get infected, and then they bring it back to the United States. And then if they come in contact, this is a very highly contagious virus, they then infect somebody who's not properly vaccinated, and then you have a spread.
Holly, what about the parents who say it's my right to choose whether I vaccinate my kid or not?
Right. You know, Anthony, we hear this term kind of personal decision thrown around a lot when it comes to vaccines. But the reason that vaccination isn't personal is because vaccination only works if everybody gets the vaccine. You know, part of the point of vaccinating everyone is to eradicate illnesses altogether, not just to protect the individual. So the decisions we have to make aren't just about ourselves, they're about our society kind of as a whole.
And it's not just, there are personal decisions and then there are personal decisions. It's a personal decision not to get a colonoscopy. And if, God forbid, that person doesn't get a colonoscopy and gets colon cancer, that's terrible. But you're affecting just yourself. And, of course, all your loved one and friends who are sad that you get sick. When you decide not to vaccinate your child, you're making a decision not only for that child, but for all of the other people, a ton of other people who aren't able to, for example, get immunized themselves. For a kid who is 12 months, under the age of 12 months, that child has not yet been vaccinated and is vulnerable.
Do we think fear is the primary motivation for people not getting vaccines of some kind?
Yeah, you know, there was actually a study out earlier this month that showed people do feel fearful, and even when you back that fear, you know, when you try to get rid of their fears by showing facts and science and everything else, it doesn't necessarily change their minds. There is something emotional about the process of vaccination, and I do think that's why we really have to kind of let science lead us in our decisions rather than emotion.
You mentioned travel. So if we're going somewhere, is there a place for us to check if there's been a measles outbreak in that location?
Yeah, there are online. You can go to the CDC site and find out, you know, in Africa, in China, parts of Europe. I mentioned the Philippines has had a big outbreak, and you can find out. Now, I think one fact that I learned in doing the research for this, which I did not know, is that normally the first vaccine is 12 to 15 months, then there's a booster at age 4 to 6 years old.
Right.
The CDC says that if you are going to an area in the world where there's a lot of measles, that you can talk to your doctor about getting a vaccine from 6 months to 11 months. and that this will offer some protection. Now, it might not be perfect protection, right, but at least it does something. And then they emphasize that that's just sort of a little extra. You have to then go ahead and get the regular 12 to 15 months, the other two, and 4 to 6 years old.
Right. Also this week, another story that made headlines, a major review in the Journal of the American Medical Association that reevaluates the risks and benefits of mammograms. Holly, tell us about this study.
Yeah, Anthony, this was a large study. It looked at over 50 years of research. And ultimately, they found that mammograms save lives, but not as many as we might have thought. So they decrease the risk of dying from breast cancer by 19% overall, more for women who are older and at high risk. But there's also a downside. Many mammograms lead to unnecessary follow-up procedures, biopsies, and things that turn out not to be cancer. And also, some women are treated for tumors that aren't aggressive enough to have caused them problems later in life. So mammograms do have their benefits, but it's not without some risks.
I have to be honest with you, though, every time there's new guidelines, I just get confused because it seems like the guidelines keep on changing. So how do women know what they're supposed to do?
Right, and I think they are confusing. Ultimately, there's not a one-size-fits-all. Mammograms are most effective and most life-saving for women who are at high risk. So it really is about identifying your risks and sitting down and having a discussion with your doctor so you get the screening that you need.
Swedish researchers say they have developed a simple blood test that can be useful in the emergency room. A new study shows that the test, plus an EKG, were 99% accurate in determining which patients with chest pain will not have a heart attack. It could help doctors decide which patients to send home and who needs more care.
A study from the University of Iowa says there's a possible association between diet soda and heart disease in postmenopausal women. This study, John's been getting a lot of attention on social media. Can you put it in perspective for us?
I think the key word there is possible.
Right.
Now, I'm no fan of soda. I like water. But I think if you look at these studies, and there have been other research in past years, they all take great pains to say this is an association. We don't know if this is cause and effect. They try to correct for things like, for example, that people who are overweight may be drinking more diet soda, and maybe it's the obesity, or maybe the diet soda is somehow a marker for some other thing that is causing the heart disease. So I'm very, very cautious about a study like this. If you're going to say there's a scientific reason why an entire industry should be affected, I think you have to be very careful before you say that. I mean, I think we should all eat real food and drink a lot of water, but again, I think people need to understand that scientifically there is no proof that this actually is causing the heart disease. And even the lead author said this raises more questions than it answers.
Dr. John LeBouf, Dr. Holly Phillips, thank you so much.